Good morning. I'm Dr. Stephanie Brown Johnson, and today we're going to be talking about whole health.
I'm Patricia Jenkins, and I'm a nurse at Primary Care.
I'm Dr. Phyllis Rutledge, and I'm a staff physician in primary care.
So you may be wondering, what is whole health? What does that term mean? You've probably heard the term whole health, may have heard also the term integrative medicine, and I think these are words that we're using, and we want to first just make sure that you understand what these words are about. So to really understand the word whole health, we need to start with another word, which is complementary medicine. Complementary medicine refers to medicine practices that are outside of the conventional or the traditional or what's usually called the Western medicine approaches. And complementary medicine includes things like acupuncture, meditation, integrative nutrition, yoga, tai chi, and healing touch, and many, many more things. So why is that important? Complementary medicine is something that is now becoming more mainstream in the care of people in the West. And so the terms whole health and the term integrative medicine means that we are combining, putting together both the complementary techniques and the more conventional or Western or traditional techniques. And that is the term, when you put those things together, then we come up with terms like whole health or integrative medicine. The CDC has been doing a lot of research, and they've noted that in the United States, we could prevent probably about 20 to 40% of the deaths that occur every year if people would undergo lifestyle changes. And complementary medicine is a lot about doing lifestyle changes. We're finding that more and more Americans are using complementary practices and are interested in them. There have been a lot of studies in the VA as well that show that veterans are very interested in combining complementary medical practices with the health care that they receive at the hospital. So exciting things are happening. Starting back in about 2010, 2011, the Office of Patient-Centered Care, which is a national office of the VA, began really working to get the education out to medical centers, VA medical centers across the country about the importance of complementary medicine and the importance of bringing it all together so that it is a whole health approach. And so one of the main things that they wanted to do is they wanted to shift the focus of care here at the VA from one that is considered primarily disease focused to one that is wellness focused and is about helping each veteran to achieve the best life and to live the best life that they can. And we're excited about the fact that in 2017, the National VA decided in this whole goal of really shifting the focus of care that they would name a flagship whole health site in each of the regions across the country for VA hospitals. And the Atlanta VA was chosen as the whole health flagship for our region, which is VISN 7.
I guess you want to know, how can you get involved with this? We encourage you to take the introductory class for whole health. It's a 2-hour class which introduces you to the circle, working the body, surroundings, personal development, food and drink, recharge, family, friends, and coworkers, spirit and soul, and power of the mind. If you see who's in the middle, it's all about you. We recommend taking this class, and during the class you will complete a personal health inventory in which you get to know a lot about yourself, and you can share if you're comfortable. During the second half, we'll have facilitators that have coaching, and we encourage you to continue to follow up for monthly groups, 3 to 6 months, and we also have additional opportunities for individual coaching by peer supports.
So let's talk about the classes. Like Pat said, in the whole health maintenance track, we have the whole health introduction, We have monthly support groups, and in the future we'll be having individual coaching available. In the food and nutrition track, we actually have 4 classes. Food as Medicine is a general nutrition class, where hopefully you'll discover how real food can be the medicine that you need. Nutritional psychology is really about learning how to eat to support having a healthy brain and healthy moods. Psychology of eating is the next class, and that's different from nutritional psychology. That has to do with the emotional component that we attach to food and how we can overcome food addictions and make healthy choices. The 4th class we have is a demonstration cooking class where the dietitian actually prepares a meal and gives out the recipe, and participants are encouraged to try that by themselves at home. We developed the Cooking for Wellness class because a lot of patients after attending the Food as Medicine class would say, well, I don't eat vegetables, I don't even know how to cook them. So the dietitian came up with a class to show people how to cook healthy. In the 3rd track, The Power of the Mind, we have mindfulness meditation. That's an 8-week class. It's really very popular. It helps teach you how to be present and calm in your everyday moments of your life, and that can affect a lot of different chronic medical conditions and help you manage them better, okay? We have a stress management class. It helps you understand what stress is and learn techniques so that you can help relieve it, you can manage it. We know we're always going to have stress in our lives, but we need to find ways that we can calm ourselves down and manage our stress so it doesn't affect our health negatively. Okay. Working the body is the next track. Presently we have yoga, and coming soon, probably before the end of the year, will be Tai Chi. The yoga we have is actually a gentle yoga. It is available for most patients with chronic medical conditions and certain physical conditions. It's a chair yoga. It's taught by a yoga therapist who's used to dealing with patients with chronic medical conditions. So we encourage you to try it. It's not what you're thinking about, having to hold those postures and everything. We will be offering a mat yoga class for the general population also. Okay. So the 5th track is Vitalize. And what Vitalize incorporates is spirituality, and that class is going to be taught by the chaplain. And then also classes on personal development and relationships. We have a 6th track. 5 tracks are actually required for the flagship by the Office of Patient-Centered Care. The 6th one that we're already offering is energy medicine. We're lucky to have some practitioners of energy medicine at the Atlanta VA healthcare system, and they're offering classes in acupressure, which is actually a self-care class. So she teaches you the acupressure points on your body that would help you with a particular medical condition that you might have. And the same thing with healing touch. It's a self-care class. She's not doing the healing touch on you, she's teaching you how to do it to yourself for particular medical conditions. Currently, we have classes at 3 locations. We're located at the Atlanta VA Clinic on Arcadia in Decatur, the VA Medical Center, and in Fort Mac. And in the future, we'll be spreading to hopefully many more sites.
So, now that we've introduced you a bit to the concepts of whole health, taught you a little bit about the circle and whole health introduction and the many classes that we have, I'm sure your next question is, how do I get involved? So there are basically 2 ways to do that. One is that in your primary care team or your mental health team, any of the providers, the nurse, the social worker, the nutrition, the physician, can all refer you to the Integrative Health and Wellness Program. So they can put a referral in, and when they do that, you will receive a call from one of the whole health staff, and they'll help you to begin this journey. We recommend, as Pat mentioned, that you start with the whole health introduction, and that really introduces you to the concepts and gets you on your way. Now, you can also do a self-referral, and you'll notice at the bottom of our circle here, we have our number, and if you call that number, you'll probably be asked to leave a message, so don't be discouraged by that. Someone will return your call, and again, they'll discuss with you the many class offerings and also get you started with whole health intro and with the rest of the classes. So we appreciate you spending time with us this morning and are delighted to have these programs here at the Atlanta VA.
Okay, ladies, already we're getting questions coming in. One question is, how does whole health help with the opioid addiction that's causing trouble across the VA?
Okay, so we've had a question about how whole health can help with the opioid addiction crisis that's happening not only in the VA but across our country. And what's really wonderful is that many of the practices that whole health offers, such as meditation, such as acupuncture, are practices that can help the body to turn away from some of the cravings that people may experience for opioids, and have other mechanisms of relieving some of the physical and mental distress that's caused by opioid addiction. So a lot of whole health practices can be used to help relieve and to divert the body to better, more healthy ways to cope with pain and with other types of distress that may be causing the person to move in that direction. So these are going to be very useful practices in helping to combat and help people to recover from these opioid addiction states.
The other thing is that as part of the Whole Health Flagship, we are going to be hiring chiropractors. So we want to offer another method of treating chronic pain. And then also we have the Empower Veterans Program for patients with severe chronic pain, and we'll be expanding their offerings to other areas in the Atlanta VA healthcare system.
Okay, another question, are these programs gender specific?
You want to answer that now?
No, it's welcome to all.
Right.
Here's one, I'm suffering from PTSD. How can this program help me in that situation?
You want to answer that?
Do you want to answer that?
Probably the Power of the Mind classes with the mindfulness meditation and stress management would really help you be aware of the symptoms that you're having and offer you other ways to deal with them. The Power of the Mind is taught by a social worker and a health psychologist. So they're used to dealing with patients who have mental health diagnosis, from PTSD, substance abuse, depression, anxiety.
In addition, I would say that the yoga classes can also be very helpful for veterans that may be suffering from symptoms of post-traumatic stress disorder, in that class also combines not only just the body movement, but also a form of meditation, which can be very helpful in relieving stress and anguish. So I think that would be another class that would be helpful for someone with post-traumatic stress disorder.
I want to add something to that too. I think all the classes, because if you come to some of the classes and be with other people, it helps a lot when you're around other people.
That's a good point.
Being isolated is just not a good thing.
Yeah, it actually becomes a support
Yeah.
group.
Mhm.
It's a community.
Yeah.
We need each other.
Yeah, that's a
That's
very
true.
good point. And we have, after you attend the Whole Health Introduction class, you'll be invited to attend a Whole Health Support Group that meets monthly. So that's another way of forming a community, such as Ms.
Right.
Jenkins mentioned. And so it's a good way to be able to talk and work through problems. And there's coaches there that will help you.
Right.
Okay. Does anyone preaching whole health, can you talk about how whole health applies to those with chronic pain problems?
Okay.
Good answer.
Sure. Well, as we were just explaining before, yoga, mindfulness meditation, stress reduction, even Tai Chi, because Tai Chi is about sort of like a moving meditation. And these are all things that can help you manage your pain and also give you another technique for managing your pain so that you're not totally focused on the pain.
Right.
When you become focused on something else, you have something that you can do when you feel the pain, and you're focusing on something else, then it takes your mind off of the intensity of the pain. So it helps you manage your pain better. Do you have anything else that, and also with the Empower Veterans Program for patients with severe pain, they go through using all of these whole health techniques
Right.
in a very intense program. And that's available through the whole health system too.
I think we can also add in there the importance of our integrative nutrition classes.
That's true.
Because learning how to eat in a more healthy way can also be something that can help with chronic pain and with a lot of disorders that are really based in the body's autoimmune response. And so many of the classes teach you about that, and the Food as Medicine class, which is one of the classes that Dr. Rutledge facilitates, as well as many of our nutritionists here at the medical center, will teach you about how food is really your primary medicine. And as you learn to eat properly and learn to eat in ways that really nourish your body and not hurt your body, you'll find that many chronic medical problems, many chronic pain disorders will improve with just an improvement in your diet.
Right, actually that Food as Medicine class explains about chronic inflammation
Right.
and how that contributes to chronic pain and chronic medical diseases. So it teaches you about the anti-inflammatory diet and how you can eat to decrease inflammation in your body. And we also talk about elimination diets because there are certain food sensitivities that people have that can trigger inflammation in their body. So it is really important. It makes a difference. I have chronic problems with my joints and things, and it does make a difference when you learn how to eat. You can directly correlate certain symptoms with, okay, what did I eat yesterday? So that really is another way too. It really is a holistic approach from the mindfulness, the food, the exercise, moving the body. That therapeutic yoga class will get you moving your body and understanding how even with the conditions that you have, the small things you can do that will make a change, with time.
Are most of the coaching sessions done in group settings or individual settings?
You want to talk about that?
It's really group settings, but we do individual too. But most of the time it should be, we start off a whole intro class as a group.
It's in group settings now. That's what we actually started on our own before we were designated as the flagship. But we are going to be hiring health coaches, so we will be able to provide individual coaching. But it will have to do with the intensity of need. So it'll be open to patients who have severe
Right.
medical conditions and need that individual coaching.
So I guess that goes back to the first question where the veteran wanted to know, are these gender specific? So are the group settings for male groups and female groups?
All one group, male, female, and males together.
And if females wanted to have individual sessions, I guess where they're coming from.
Yeah.
She's going to answer that. Mhm.
Yeah. So we're getting questions about the gender specific nature of groups, and in general our groups are co-ed. However, for instance yoga, we have in the past offered a female yoga class, a women's only yoga class. We don't currently have that, but our classes are evolving. And this is a new program. So as veterans, after each class, we ask for feedback. And as the needs may be expressed, if we find that there is a need to have a gender-specific class in certain areas, then I think that that's something that we'd definitely be open to doing. So just let us know what you want and what you need, and we're going
Right.
to try to make that happen.
Any closing comments? I think we've come to the end of the session as far as questions. Any closing comments you guys like to make?
I would just like to tell them about the goals. When you do this class, you choose one goal. Start small, and we start to build on that. But we give you a chance then, and we try to coach you around what you need, what you want to do.
Yeah, so the most important thing is that it's all about you.
All about you.
And we're just trying to help you find a way to live a healthy life.
Right.
Yeah, and I guess just in closing too, I would just like to say that I think you'll find that even just the experience of the first class can be life-changing.
Really can.
The whole health intro class, in which you talk about those areas in the circle, but also have a chance to really reflect on where you are in your life in each of those areas. And you actually sort of look at where you are and then decide where you'd like to be. And that process, that thought process, can be life-changing. So I really invite you, even if you think you're not interested in any of those classes, which I find hard to imagine, but come to Whole Health Intro and participate in just that activity. And I think you'll find that that will be eye-opening and a life-changing experience. So we really appreciate you spending time with us this morning and hope that this information has been helpful. And we look forward to hearing from you.